This is Mike Steckline with the Institute for Enterprise Excellence, showing a short video today about the topic for an upcoming webinar on the topic of reducing CAUTI, that's catheter-associated urinary tract infections, presented by Lynette, Scullard, and Mary Hassler from Hennepin County Medical Center, October 25th at 11 a.m. Central Time Zone. If you want some details on dial-up and login information, you can go to this bit.ly link and get those materials and participate in our webinar on October 25th. A little bit about Hennepin County Medical Center. This comes from their website. If you go to this link, you'll be able to go immediately to this page about them, and also this link to this video about their mission, which is a nice video. A little bit about catheter-associated urinary tract infections, if you're not familiar. These are acquired infections that sometimes people will get if they've been in a facility and they have an indwelling urethral catheter, and it can cause considerable cost, of course, discomfort, and unintended consequences for patients. And many organizations have tried to take action to try to reduce these infections, and this information comes from the IHI, Institute for Healthcare Improvement website, and they discuss accepted evidence-based prevention guidelines. What you'll learn about on the webinar on October 25th is more of the practical of how to, and the learning and experience from this team about how this worked, and also how it became a sustainable improvement, going from quite a few of these infections to very few. What you'll see, I'm going to put this in context of the materials that we talk about at the Institute for Enterprise Excellence. We have two primary models that we talk about. One is the sustainability model, and the other one is the velocity model. And you can find more information about that by going to this bit.ly link, this white paper on our foundations document. Most organizations that get into this improvement journey, whether it's lean or whatever they call it, tends to take this route. We call this the program path, or the program of the month path. I heard it recently called commitment to comfort, and I think that's a beneficial or useful way to think about it. And that's where most organizations are. It's a repeated pursuit of tools in order to try to get results. And some organizations understand that that's just not going to be sustainable, and they need to approach a philosophy path, which is a lot different, quite a bit difficult, because you're changing mindsets and not just introducing new skills. What this means when organizations learn this, they learn different or new principles, new to them, principles of enterprise excellence that envelop the work systems, and they also learn about trying to create systems that help the organization to align their work, enable people to improve the work, and then to improve the work. Another framework we put together, and again you can find this on this bit.ly link up here, from a recent white paper called Side-by-Side Management, is the idea of, in an ideal state, where would people be spending their time, leaders, managers, and frontline, and reducing CAUTI infections might be a strategic focus for an organization. So you would see leaders and managers having quite a bit of action and focus in this area. Frontline has some, of course, because they're the ones at the end of the day that need to be doing the work. And this triangle over here is the connection of daily management systems. How are everyday problems being solved? And I think you're going to be hearing a lot about how this idea of a daily management system came to play in the reduction of CAUTI. And also this line right here, this notion of standard work, the idea of a current best way to do things, is something that is important, and I'm sure we're going to hear some discussion about that as far as what's the current best way in the management of these patients and the prevention of these CAUTI infections. So to sum up, October 25th, Wednesday, 11 a.m. Central Time. Information about the dial-up and login can be found at this bit.ly link. Hope you'll be able to join us. Thanks.